Hello everyone, in this video we will discuss about chronic bronchitis. Now going to the definition firstly. Now the chronic bronchitis, it is defined clinically as persistent cough along with sputum production, and this should be at least for 3 months in at least 2 consecutive years. The duration is fixed. And this should occur in absence of any other identifiable cause. Then only the diagnosis of chronic bronchitis is made. Now going to the few clinical features associated with chronic bronchitis. Firstly, as the definition suggests, there is persistent cough and this is productive of sputum. And this is the cardinal symptom. And for many years, this is the only symptom which is present, and no other respiratory functional impairment is present. But eventually, there is dyspnea on exertion which is present. Now, with passage of time, there can be other features such as hypercapnia, there can be hypoxemia, and mild cyanosis. And due to this cyanosis, the characteristic appearance of blue bloaters is seen in these patients. Now, going to the pathogenesis of the chronic bronchitis. Now, firstly, there is a primary or initiating factor, and then there is a secondary factor. Firstly, we'll discuss the primary factor. The primary factor is due to long-standing irritation, and this long-standing irritation to the epithelia of the lung can be due to tobacco smoke, and which is the most common cause of chronic bronchitis, as 90% of the patients these are smokers. But irritation can be also from the dust, from the grain, from the cotton, silica, or other pollutants, and these can lead to changes in the lung epithelia. The changes which are seen in chronic bronchitis, they are mainly two. There are two changes. There is hypersecretion of the mucus and there is hypertrophy of the submucosal glands. Now this hypersecretion of the mucus is responsible for the airway obstruction seen in case of chronic bronchitis. Now this hypersecretion of mucus is due to a marked increase in the goblet cells, and these goblet cells lead to excessive mucus production, and then there is airway obstruction. But both these submucosal gland hypertrophy and increase in the goblet cells are actually uh, the body's mechanism to protect the epithelia against the tobacco smoke or other pollutants. Now, going to the role of the infection, this is a secondary factor. Infection is not a primary factor, it is a secondary factor and is not responsible for initiating the chronic bronchitis, as chronic bronchitis is initiated from the long-standing irritants. This is responsible for maintaining the disease, and mainly it is important in acute exacerbations. That means it leads to worsening of the symptoms. Now, cigarette smoke, how does it lead to infections? It leads to infection in many ways. Firstly, it interferes with the ciliary action of the respiratory epithelium. Now the cilia, they are not working, and therefore the body is more prone to infection. Secondly, it also causes direct damage to the epithelium, and lastly, it also inhibits the ability of the leukocytes, both the bronchial and alveolar leukocytes, to clear the bacteria. Now going to the morphology in the case of chronic bronchitis. Now grossly, the affected part, it will show features of inflammation like hyperemia, there will be swelling, there will be edema, and also there will be increase in the mucus secretions, in the mucopurulent secretions. If there is infection, there will be purulent secretion present also. And if the infection is overwhelming, there can be heavy cast of secretion of pus which can fill the bronchi or the bronchioles. Now going to the histology, the microscopic features. The characteristic microscopic feature is presence of inflammatory cells, predominantly lymphocyte, because it is a chronic condition. There will be presence of lymphocytes, and if there is acute infection also present, the neutrophils will also increase. But mostly lymphocytes are seen. You can see in this picture these are all the lymphocytes which are present. And second feature which is characteristic is increase of the submucosal glands. the mucus secreting glands, and these are uh, these are measured by index known as Reed index. Now, what is Reed's index? It is used for mucus gland hyperplasia. Now, this to understand the Reed's index, we can see like this is the epithelium, then is the basement membrane, and then there is presence of mucus glands, and then is perichondrium and the cartilage. This is the of the trachea bronchioles. This is the normal arrangement. Now, what is the Reed's index? Reed's index is the thickness of the mucus gland, that is this point B and C. If we divide the B and C thickness, that is the mucus gland thickness, uh, from the uh, epithelium to the perichondrium. This is known as the Reed's index. Now, what's the Reed's index? It's the ratio of thickness of the mucus gland layer to the thickness of the wall between the epithelium and the cartilage. And when there is chronic bronchitis, as we know, there is increase in the mucus gland thickness, there is increase in the mucus glands, so the Reed's index will change. Now, normally the Reed's index is around zero point 0.4, and but in the case of chronic bronchitis, this is increased because of the increase in the mucus glands, and this is also proportional to the severity and the duration of the disease. Now, other changes which can be seen are presence of, because there is chronic irritation, there can be squamous metaplasia and dysplasia, and this is of specific importance because of this atypical metaplasia and dysplasia, the further this epithelium is prone to cancerous transformation. And in this picture we can see the normal columnar epithelium. However, here we can see the squamous metaplasia have taken place, and if squamous metaplasia is present, it should be checked for any signs of dysplasia or cancerous transformation. Now, also other features such as mucus plugging, inflammation, and fibrosis can be present, and sometimes the fibrosis can increase so much so that it can lead to obliteration of the lumen, and this condition is known as bronchiolitis obliterans. This was all about the chronic bronchitis. Do like, share, and subscribe to this channel. If you like these videos, do watch my other videos also. Thanks for watching this video.